Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcoming Kiersten LeBar, who is the Associate Chief Nursing Officer of Women's, Children, and Psychiatry at the Medical University of South Carolina. Thanks so much for being here.
Thank you.
We are really happy to once again feature somebody from MUSC. We love all of the things that you're doing, and so we're excited to talk to you. And our conversation really spanned two different realms. One, your personal experience as a child being treated at MUSC despite living in another state, and then how that formed your professional ambitions and now landing you at MUSC after a journey through 8 different academic hospital systems. And so you have a really unique perspective about both the patient experience, and you told me a compelling story about that, which hopefully you'll share during this interview, and then also how that formulates your approach to leadership and getting everybody on board for one common goal. So let's start with, what was your experience as a child? And if you could share that one story that really made an impact on you, realizing how important a nurse can be to a patient.
Sure. So as a child, I was actually a patient here at MUSC. My family and I lived, as you mentioned, out of state. And when working with our local physician team, they recommended to my parents that we come here for a procedure to Charleston, South Carolina, based on outcomes and their reputation and their ability to innovate. And so my parents brought me here. Had 3 procedures here done with some of the team that I actually did supervise, which has been exciting. And through that experience, I really got to interact with the team here, and they were so wonderful and are what ultimately inspired me to go into healthcare, to become a nurse and later on become a leader. It was always my dream to be here and to be able to support the team who really shaped my life.
And there was that one particular story that you shared about one nurse who was willing to take you to the bathroom. Can you tell us that story and why that made such a tremendous impact on you?
Yeah, there was a nurse one evening after one of my procedures, had a lot of medication and really just could not walk well. And as a young child, the idea of using a bedpan was just not something that I fathomed. So she helped me all night. She actually picked me up and carried me to the bathroom. And although, she shouldn't have, because we don't want people to get hurt, that compassion and empathy to really want to help your patient, to want to support them and make them feel comfortable, and going that extra mile is truly what it's all about. And I often think of her and, how grateful I am for what she did in those moments, and how we all collectively have those opportunities on a daily basis to really impact and influence.
Wow, we have those opportunities. Hopefully we take them. Sometimes we don't, but if we take them, this can leave an indelible mark for, decades. And it's just amazing how you've carried that literally with you for so long, and how much of an impact it's made, to the extent that you've been so motivated to go into not only your career, but come back to MUSC, and remarkable, just the little things that we can do that can have such this long lasting ripples of change. So as I'm hearing your story, Kiersten, one thing that is really coming to me, because we've met so many of your amazing leaders at MUSC, your colleagues, what I'd love to understand is that decades ago, you already found a remarkable culture there. You called it one of performance and outcomes and innovation. And that's really what we've picked up on when we've met with your fellow leaders. What have you found now that you've come back? Has the culture just deepened? Has it evolved? Has it grown in some way? And then ultimately, where are you particularly excited about growing that culture too? So just if you can take us a little bit on that arc of journey, that would be great.
Sure. So I would say that the culture has definitely deepened from what I experienced as a patient to what I now experience as a leader here. I think the culture here is one of placing the patient first and really being a patient and family-centered organization providing top quality care and continuously looking for new and improved ways to innovate and to drive change. And that is something that the teams that I support every day are very focused on. We're soon rolling out our virtual nursing program to support our frontline nurses on the units and help with clear discharge instructions and easier ways to admit patients. And so we're really excited to continue to find ways to leverage technology and innovative care models to help serve our patients better.
That's so beautiful. And, and since Stephanie is giving me the opportunity, I'm going to keep going. I love it, Kiersten. You say patient first, and it clearly comes through. And again, everything you're describing. As you know, we were talking in the pre-interview a little bit about what Stephanie and I have been working on with a great number of colleagues. We call it a loving organization, with the notion of trying to amplify organizations like what it sounds like MUSC is, and show the world that it's possible to be loving and compassionate in a systematic way and be, have great outcomes and actually be financially viable as well. So I guess, would you consider, I don't want to, put you in a spot or put words in your mouth, but from whatever you consider loving to be, would you consider MUSC to be a loving organization? How and how not, and how does that play into the kinds of outcomes that MUSC is able to deliver?
I would say we are most definitely a loving organization. I think, especially in a pediatric realm, I think we really work to support our patients. And the psychiatry team, that I supervise on a daily basis, they support a population that's often unheard, right? And really embrace the work that they do. So I would say yes, MUSC is a very loving organization. And I think sometimes, Brene Brown to me said clear is kind. And so that is how I personally lead. And I think that is love, right? When you know where your opportunities are, where you know the strategic plan and the path and how to get there. But all along the way, you're supported by a team, by a leader who knows that you can succeed and that you will succeed and helps you to get there.
Brilliant. Clarity is love. I love that. That's awesome. Thank you.
I think that's one of the things that has stood out to me, the way that you're able to walk that line and be very level-headed. I mean, your whole demeanor is very calming. And so you're able to bring that focus of the patients matter, these things matter, but also wanting to say, we have this vision, this is who we are. I want you to be the best version of yourself, which is something that you've said to us multiple times is a very important goal, and not leaving ambiguity out there, because that is where things get scary for everybody. And then not everybody's going to make the best decision for the patients or for themselves. And so when you're getting to the new organization, you've been at all of these other different academic centers and are able to bring that experience that you've had plus your patient experience. How are you able to come in and assess the lay of the land and then say, okay, these are the priorities that we really need to get right? How do you decide what matters at any organization, in this one in particular?
I think I know we kind of talked before. We all as leaders have tools in our bag that we kind of bring with us and carry with us. So a formulaic way, right, to assess the landscape of somewhere. But I also think it's really important when you take on a new leadership position anywhere to spend time on the front line, to get to know your teams and hear from them what is important to them. And through those conversations, you'll hear themes. And you'll go back to your tool bag and you'll see where those themes fit in as areas for opportunity and focus. And so that is what we've done here. That's what I've done with other teams that I've had the opportunity and privilege to support throughout my journey. And it's been a wonderful experience. And I think, circling back once you identify those things and those areas of opportunity, helping to translate the why. Why is that an opportunity? Why is that important? How does it affect your day-to-day work, your patients, the organization, our reimbursements, and tying it all together for the team and supporting them to accomplish whatever we set forward as a goal and objective.
Yeah, I love that. You have so much experience that you can bring to bear to people. It's incredible. So my mind is going in two different directions, but I guess I'll start with the way it first started going down the path, which is that as you went from being a patient to then a clinician to then a leader, you have gone and been at so many amazing medical centers and picked up a lot along the way. I'd love to learn a little bit about what are some of the ideas that you picked up along the way, and what did you learn from particularly some of the leaders that you mentioned earlier that were really impactful for you?
Yeah. So I was fortunate to start my career in an environment that really valued interdisciplinary teamwork, relationships, research, evidence, education. And I think for me, that was the foundation and my launching pad for the rest of my professional career. And as we all journey around, we get the opportunity to interact with various folks and work for many people with different personalities, different backgrounds. And I think you take with you the pieces that you want to aspire to be or embed in how you lead. And I think it gives you great opportunity for reflection. And so as I've come around, I think what I have taken with me is the ability to support people, the ability to view myself as the bottom of a pyramid, supporting everyone to be the best version of themselves, to showcase the why, to be empathetic, and to be able to have those difficult conversations on both sides, and move forward to be, again, the best versions of ourselves so that we can then provide the best care to our patients and their families.
How do you get the buy-in whenever you go to a new place and they're already doing things in a certain way? And in MUSC's case, it's a very innovative organization where they are open to ideas. So maybe it was less of a situation with resistance, but it's still like, oh my gosh, it's a new leader. Maybe I liked that previous leader, or maybe I didn't like that previous leader. And there's that barrier that I have up because of that. So no matter what, you're going to have all these different obstacles when you go into a situation. How do you go in and get the buy-in from them to say, okay, yeah, that does make sense. I understand and I'm on board with you now?
Yeah, I think it's all about relationships and spending time building the relationships intentionally and listening. And from those moments, you can begin to think about what will be our next steps together. And you can begin to have conversations, tell me your thoughts, tell me your opinion. Has this been tried here before? Did it not work? Tell me why. Many of the things we're doing here now have been tried before, but have not been successful. And I think it was all in perhaps the approach. Maybe the people put in charge of executing it at the time, they're different. They're different now. It's a different team now. And that is something that I share with folks when they say things like, oh, well, we tried that. It's like, yeah, but look around. It's a whole different group of people. It's a different place and time. And so we're going to try it again.
The reason why I think people are not doing this is because they are thinking of the worst that can happen. The way you answered that question immediately got me thinking. I take the time and spend, time getting to know the people, listening to them, talking to them. I think that's kind of the first roadblock for most people. It's going to take too much time. I don't have the time. I was just hired. I'm a new leader. I've got oodles of responsibilities and lots of people to meet. I don't have the time. So can you help us think through how, in a practical way, how much time does it actually take? Why should this not be a barrier to other people? How do you help that other leaders in new situations understand how are they going to be able to carry out such a relatively simple and so critical of a practice?
I think many things that I do as a leader are very intentional. So when you start in a new organization, being very intentional about your time, it's easy for people to take it from you, but you need to block it. You need to block your calendar or set up an hour and just be very intentional about meeting the people that you are going to support and meeting the leaders that are part of those teams and getting to know them and listening to the themes that will ultimately come from those conversations. And I think to this day, as an organization, nursing blocks an hour on our calendars every week. And I mean, every day, sorry, not every week, every day. And that is a time meant for us to go and round on our teams, say hello, not to be, stuck on meetings or busy at your desk. It's really an intentional, thoughtful time to take a break and go and check in on everyone. And so I do that every day. And then there's times throughout the week where I have a couple hours blocked and I'll go out and see the team, and I bring them candy and they love it. And I take orders on the candy too, because everybody has preferences, right? Again, we're all from different places and spaces. And so everybody has a different thing they like.
And I think even that, just getting to know somebody as a human and recognizing that they're, not just a droid providing service or like a vending machine of care. It's a real person behind there who's doing this. And, sometimes having a Reese's cup in a place where there's not a nut allergy might just be what you need that day. So I love that. And how do those relationships then tie into what you told us in the pre-interview is one of the most important things, being able to get all of the different teams to talk the same, realize that they have the same goal, even if they're speaking different languages about it, which can sometimes be a barrier.
Yeah, I think having built the relationships and been intentional up front, then when the hard days happen or when we all need to get on the same page and sometimes agree to disagree, I think having built that foundation makes those days easier and those conversations easier to navigate.
Yeah, that's awesome. And you're such a loving leader, so intentional, so kind of aware of yourself and your people. So it feels like, and probably maybe something you've been developing over a long period of time over this journey. I'd love to hear some more tips from you in terms of loving communication or feedback. Like, how do you have difficult conversations with people? You still have to hold people accountable. So that's another place where I feel people get stuck is this compassion and empathy and love. It's all great, but we're running a business here, so maybe you can help us understand that it's possible to do that and still be a loving person.
Yeah, to be honest, I don't love those conversations either, and I think acknowledging that is the first step. And often, when I have to have difficult conversations, I lead with that. Hey, I'm sad that we have to have this conversation because you are better than this, or I know you can do better. And so just owning it up front and then walking through the next steps with my team and really just moving forward. I try to have the conversations, in private, in a quiet space. And I was sharing with Stephanie, sometimes I have my essential oils going just so everybody's nice and relaxed. But often I think those conversations go well. And again, I think clear is kind. And I think sometimes when we're not clear and we don't address things in real time, they manifest in other ways. And it actually gets worse instead of better.
And something else I was recalling back from when you and I talked previously is that you said sometimes when these situations happen and then you are able to be clear with one another both directions, things come out that you may not even have realized, that maybe this person doesn't love that role and they're better at this and they are really amazing at doing something else. And you told me that in some cases you were able to rehome people into different places where they're really excelling and then help develop other leaders because you might realize there's a need that you didn't know. But after having that open conversation, you're on a totally different playing field.
Yeah, I have had many of those conversations throughout my career. I think sometimes people get put into various roles because they're deemed an expert, whether it's an expert at the bedside or an expert in a different space. And then we think, oh, you'll make a great leader. And sometimes that doesn't translate. And I think having those open and honest conversations, sometimes people come to the same conclusion. And then helping them to be successful in a different role, it is rewarding to watch that transition from really, was it something that wasn't going well for anyone, transition to something that is great and successful for everyone. And I have the opportunity to have some of those leaders on my teams over the years. And, again, not fun conversations. Nobody feels good about it. But in the end, it yields something wonderful.
And it has to, on some level, be empowering to them too, because it doesn't feel like somebody's giving up on you. It feels like, okay, you're seeing me, and then you're giving me this opportunity to do something else that I am more passionate about. Because to your point, sometimes people do just get placed into, oh, well, they're the expert on this, let's make them that. But nobody ever considers them and asking and saying, oh, do you want this leadership position? Well, no, I love the bedside and I just want to stay here with patients day to day.
That's a great segue, Stephanie. I guess what I was thinking based on your comment and Kirsten's is like taking that positive, affirmative approach. It's really possible to kind of still be open and gracious and receptive, even during a difficult conversation. It helps us when we're going into that and anticipating that conversation, and it certainly helps our colleague or our recipient of that conversation. So to me, it feels like it's really bringing in a sense of positivity and possibility, even if you have to kind of bring difficult messages into the conversation as well. So Kirsten, I guess I hope this one isn't too much of a brain twist, but I'm kind of been thinking about this for a little bit while we've been talking. Is how do you take all these great things that you have been doing as a leader and make them more systematic as an embedded in the organization, so it's not just dependent on Kirsten? And if she's gone, then another leader is going to come in, and now it's going to be something different. But this leadership approach that you're talking about, empathy and caring and kindness, it actually winds up becoming a part and parcel of the department or the organization. So do you have thoughts on how that happens?
I think it's all about role modeling and building your team, right? Always having succession plan and teaching them what's important to you. And of course, others will have their own values and their own way of doing things. But I think showing them that there are ways to lead in which people feel supported and cared for, and hoping that that sticks, that's the piece that they take away. And so for the teams that I have the opportunities to support, I think it is sticking. And it's been great to see all the different things that have been put in place that are little branches of what I have done, and maybe even now done better.
Amazing. Thank you so much for being here. This was a fantastic conversation with so many lessons along the way.
Thank you for sharing, Kirsten. That was really remarkable.
Thank you.
And thank you all for watching. We'll talk to you soon. Bye-bye.